Hello, my name is Rachel Kelly, and my topic for week 5's discussion post is conjunctivitis. So everybody is familiar with conjunctivitis as red eye, something you've either experienced growing up or you know somebody that has. It's inflammation or infection of the conjunctiva of your eye that causes the redness. So there are 3 different types of conjunctivitis that you can divide all cases between. We have the allergic conjunctivitis, so that's obviously associated with allergies. This could be related to dust or pollen, aggravating the eye, the conjunctiva. We have viral conjunctivitis, which is contaminated fingers, medical instruments, swimming pool water, all personal items. It's the same reason your mother always told you not to share your mascara. And then we have bacterial conjunctivitis, which is the one that's associated with the spread of infection, like, for instance, chlamydia or herpes, and also contaminated fingers, fecal matter. You could also have an issue with like a laceration in your eye that could lead to a bacterial infection, and that could cause conjunctivitis. There could be an abnormality in an anatomical structure in your eye. Maybe trauma causes it, and it also could be neonatal in origin, and those are all versions of bacterial. The immunosuppressed are also at risk for a bacterial infection, so anyone with cancer on chemotherapy or any other corticosteroid, anything that compromises your immunology. So, as a nurse, when you're assessing conjunctivitis, you're going to see perhaps redness in one or both eyes. The patient may be experiencing itching, tearing. Vision could be compromised by the swelling or inflammation in the eye. So purulent and mucopurulent, so mucus and purulent discharge, are commonly seen in conjunctivitis. And this, you could also have edema in the eye, so eyelid swelling. Both of these put you at risk for decreased visual acuity. The eyes may be burning, and you also may experience photophobia, so sensitivity to light. So potential nursing diagnoses for a patient with conjunctivitis include pain management, anxiety management, risk for injury, and this is also related to the loss of visual acuity, the spread of infection, and also impaired self-concept, because you are going to, the patient is experiencing a change in how they look. So the red eyes could be making them feel bad about themselves, and the swelling and the discharge, it's unattractive. So they may feel unattractive, and that is something potentially we need to intervene with. So the conjunctivitis nursing plans include addressing all of these potential diagnoses. So you're going to come up with a plan for pain management, an anxiety management plan. You're going to prevent injuries, so this will be safety precautions like fall precautions if the patient is extremely compromised in their ability to see, especially if it's in both eyes with a lot of swelling, discharge. You also are going to prevent the spread of infection. That's going to have an education element, and you're going to want to help the patient maintain a positive self-concept. And for the case of patients that may have received this, got conjunctivitis through certain lifestyle factors, whether it be related to their sex life or hygiene, you're going to educate the client on avoiding that in the future. So implementations for nursing, for conjunctivitis, we're going to assess and relieve the pain and discomfort. We're going to use the prescribed drugs, which are most common analgesics for reducing the pain. In certain cases where it is indicated, there will be an antibiotic. This will help the spread of avoid the spread of the infection, and it will also aid in having a quicker recovery time for our patient. So in terms of taking care of the eye, you're going to compress the edge of the eye while it's closed with a saline solution for approximately 3 minutes to get rid of some of the discharge. This is especially important to do after a night of sleep, where the discharge can become accumulate. So when you clear that discharge, you're going to wipe slowly. You're going to avoid causing any additional pain, and it will also, by cleaning it, avoid the spread of the infection, because this discharge is infected. And so you're also going to want to be careful to dispose of any tissues or materials that you use to remove the discharge immediately, and make sure that there is no chance that they could cause further spreading of this infection. So for clients with photophobia, they will be recommended to possibly wear dark sunglasses. This will just prevent them from feeling the pain of light. We also are going to educate the patient on hygiene that could prevent the spread or reoccurrence of this infection. So proper hand washing is a major point for these patients. You're going to want to encourage the patients to avoid sharing any personal cloths, but also personal items that could spread the infection. So I said before mascara, but I think that is a common example that I have encountered in my life. Do not share anything that touches your eyes. Replace eye cosmetics. There we go. Teach the patient to install the eye drops. So you're going to want to teach them how to do the eye drops and ointment. While you're doing it, might be a great time to begin the education. Obviously not in the most acute phase when the pain is overwhelming, but as they recover, you're going to want to show them how they should be taking care of their own infection, so that when they are discharged, they can continue to administer the ointment and eye drops as prescribed in order to be fully recovered. They're also going to want to finish whatever antibiotics they're prescribed. You're going to make a point to emphasize that. So naturally, they're going to be advised to avoid rubbing their eyes at all, and they're going to want to stay away from public places for quite some time, at least 7 days, while they're recovering from this infection, to avoid the spread and also to avoid themselves getting any more ill. So lastly, for your conjunctivitis patient, you're going to evaluate your interventions and their success. For the patient that was diagnosed with acute pain, the client's pain was relieved and pain and discomfort were relieved, and they reported 0 out of 10 by the end of the shift. Goal met. You're going to want to have a client that reports no anxiety throughout the shift or remains free from injury throughout the shift. All of these reflect the diagnoses we stated before. The client does not spread the infection throughout the course of their hospital stay, and the client expressed a positive self-concept by discharge. All of these address the diagnoses that I see as possibly indicated for a patient with this disorder, and based on our interventions, it seems that we could evaluate them as successful. Thank you for your time, and that is my discussion post for week 5.